Good morning, good afternoon, and good evening to everyone joining us from around the world. I'm Alan Kuriakos, Fundraising Coordinator at the Stephen Lewis Foundation. Thank you for being here today to mark National Coming Out Day with Colin Druhan and Luswata Brant. I'd like to start today's event with a land acknowledgement. As an organization based in Canada, the Stephen Lewis Foundation acknowledges that our presence here is a direct outcome of the settler colonial state, whose policies of expulsion from the land and cultural genocide continue to impact Indigenous communities today. I'm joining the event today from the offices of the Stephen Lewis Foundation, which are located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. The Stephen Lewis Foundation acknowledges that oppressive and inequitable socioeconomic and political systems in Canada continue to perpetuate a legacy of racism, intergenerational trauma, and structural inequality, and that this legacy is directly linked to the disproportionate impact of HIV on Indigenous communities within Canada. We at the Stephen Lewis Foundation are committed to the principles of social justice, equality, and solidarity with our community-led partners as they face the continued effects of colonialism, including the homophobia and transphobia. Consistent with those values, the SLF is undertaking a journey of ongoing learning, reflection, relationship building, and solidarity with Indigenous communities in Canada. Once again, thank you to everyone who has joined in today. I encourage you to use the chat function to share your name and where you're from. Throughout the session, please use the Q&A feature to ask any questions you have for Brant or Colin. Today, we have the pleasure of listening to Colin and Brant in conversation. Colin is the Executive Director of Pride at Work Canada, where he is dedicated to fostering the equitable participation of 2S LGBTIQA+ people in Canada's labour market, and also a Stephen Lewis Foundation board member. Luswata Brant is a human rights defender and Executive Director of Icebreakers Uganda, home to Uganda's first LGBTIQ health clinic. IBU is an LGBTIQ-led organization and current Stephen Lewis Foundation partner. Welcome and thank you both for joining us. Over to you, Colin.
Thank you, Alan. Thank you, everybody at SLF for organizing today. Thank you, too, for starting us off with a land acknowledgement on behalf of the Stephen Lewis Foundation. Like Alan said, I'm on the board of the Stephen Lewis Foundation. I'm also the Executive Director of Pride at Work Canada, and we're neighbors. So Alan is just up the street at SLF's office, and I'm down the street at 192 Spadina in Pride at Work Canada's offices. And the building that I'm in is actually called the Murray Building. And it was established in 1920. And that year is very significant in the context of the history of Canada. That was the year the Indian Act was amended to require Indigenous children to attend residential schools. So when we do land acknowledgements in this building, we often reflect on the fact that, the legacy of residential schools still exists as this building still exists. And if this building is still standing 100+ years later and serving its original purpose, it's not so wild to imagine that the original purpose of that residential school system is still being served in Canada. So it's important that we take actions like the one that Alan talked about in his land acknowledgement. It's important that the folks from Pride at Work Canada's network, from Corporate Canada, think about call to action number 92, which is the only call to action for Corporate Canada. And we also think about SLF's anti-colonial approach to funding. But you're not here to listen to me talk a lot about Pride at Work Canada or talk about SLF. We're here to hear from Brant. Brant is the Executive Director of Icebreakers Uganda, as Alan said. And he's an incredible leader, not just within Uganda, but I think one of the most incredible leaders that I've encountered across my career globally, who's just working in service of queer and trans communities, both directly where he lives and across his country. So I want to dive right in so that we can hear as much as possible from Brant, who I'm just starting my workday in Toronto. Brant actually just finished his workday, so he just braved traffic to get home from the office. And we're going to start because today is about National Coming Out Day, which is on October 11th. But Brant, this day has become a momentous occasion for a lot of people in our community. Can you share your own coming out story with us and how it's influenced your path as an advocate? And also, how is your day going?
Thank you. Thank you, everyone. Good morning from that side and good evening from our country. As I've been actually introduced, I'm Luswata Brant. I'm the Executive Director of Icebreakers Uganda. Icebreakers Uganda will operate the first ever LGBTI clinic in Uganda that gives out free health services to LGBT personnel. When I hear about the National Coming Out Day, it brings a lot of emotions in my life. One, when I was coming out, I had a lot of mixed feelings. I kept on asking myself, is it the right time or is it not the right time? Is it the right time? So how did I come out? So I remember I have a sister that I follow. She has a very, very long nose. When I talk about long nose, she really wants to know what is really happening in our lives. So one day, we went to a wedding ceremony. So she was there. She was among the organizers. She told me to invite my friends over. So I invited my queer friends over. Yeah. So I invited like 2 of my gay friends and then 2 of my lesbian friends. So when we attended the wedding, after the wedding, she called us on a side. She told us, "You guys, what do you do? What work do you what kind of work do you do?" Because actually, apparently, she had gone to our social media platform. She has seen us actually working. She has seen us traveling. And in Uganda, when you see people traveling, one, they are queer people. 2, they are going to sell sex. Yeah, because actually, yeah, and then she told me, you know what, every time, Brant, every month you're traveling, you're on plane, what are you really going to do there? So one time, she tricked my little sister. So I decided, because my little sister was a bit coming forth, because she really used to talk to me. She used to talk to me about her school and all that. She really listened to me. So one time, I decided to tell my sister, because I was tired of explaining myself. I work with refugees. Of course, I didn't work with refugees. So I told my sister, I'm like, you know what, I'm queer. And then yes, we had a conversation, and I'm like, I'm coming out to you. I assume someone from my family should know, not knowing that actually my coming out to her, it's a mess. What she did, she went back and told my nosy sister, my elder sister, that, you know what, yes, Brant is gay, and Brant has every friend you see around Brant, they are gay friends, not knowing that I can have even actually heterosexual friends. So, and remember, I have a kid. I had a kid when I was 14 years of age and in school. So when I had a kid, the kid stays with my mom. Now things started to change. Things started to change. They started actually, I remember them organizing a meeting with me at a certain social place. They told me, you know what, Brant, you went to school. Why are you into this thing? Are you looking for money? You have a kid. How could you? And then actually, I was walking to the washroom, and they told me, you see, a man cannot walk like a lady. You're cross-cutting. So I really started facing a lot of challenges, whereby they even actually threatened to give me back my son to stay because actually the kind of work I do, I cannot stay with my son because 1 week I'm here, the next week I'm in the field, the other week I'm in Canada, the other week I'm in next month I'm going to, so I couldn't handle staying with my son. So they started actually the mess up, the family started to know. I remember that time where we lost a loved one, and actually going there, I had to, to cross check myself, how I dress, how I paint, how I trim my hair, how I talk to people. So there's a lot of stigma and discrimination I went through when I came out was really unmeasurable. They even went ahead and told my mom about my sexual orientation. So at one time, my mom called me and like, okay, come. What do you do? So I started to camouflage around, telling my mom, you know what, I work with refugees, but there are so many kind of refugees in order to protect my son. But then they didn't buy it. My sister started actually pushing me. You go check out his house, check out the lifestyle. And actually, guess what? Things got worse, and then that's the time I was actually having an interview about the clinic of Icebreakers Uganda, and by the time I was the clinic manager, so giving the profile, working with the first ever LGBTI clinic. So one of my relatives got the video, because when you go to Google and Google my name, Luswata Brant, of course, the first interview they'll bring is about the first ever LGBTI clinic in Uganda. So they went ahead, it's family, showing family, you know what, we told you that Brant is gay, you couldn't we couldn't admit. You see the kind of the interviews, and then they started actually questioning me, where's that clinic, because my mom stays close. My mom stays like 20 minutes to my office. So they started saying, yeah, that office is on Salama Road. Salama Road is the road that address of our offices. So I started facing a lot of challenges. Remember, even at the people I thought they were on my side, they were not on my side. So I started even not seeing my family, my friends, because I mean, they started actually even um how do I say it in English? Started actually following me up. Yeah, my social place. I remember I was in a bar and a social place, and then when I looked up behind, they were seated, questioning me a lot of questions. So the stigma, the mental health challenges I went through when coming back really broke me, because first of all, I couldn't actually, I didn't even want to come out to my son, because by the time he was a young person, and I could by that time actually come out to him. That's why I always actually keep them at my place. My mom told me, you know what, from now I'm going to give your son. For me, I cannot do that. What do you really want? They even actually, I went through even the church conversion. I had to try to change me. They prayed for me. They even actually brought pastors at home to pray for me. The level of stigma, discrimination, mental health challenges I went through while coming out was really unmeasurable. But actually, it impacted a lot with my work. So I started actually blocking people that I know on social media platform. So and then you block them on Facebook, on WhatsApp. One of the families is actually viewing your status. So what I decided, I'm like, oh, okay, what am I going to do? Because things are getting out of hand, and it's kind of challenging when your family stay closer to you. Because my mom's home being 20 minutes away from my workplace, that is close. Yeah, and then remember, my sister, they're always social people, so everywhere you go. I remember I had a meeting in a certain hotel. Walking into that hotel, my sister's family were having breakfast. So they asked me, okay, where are you going? So I'm like, have a meeting. Which kind of meeting? Yeah. So I had to lie. And then, they started calling, mom, we have a family group. Brant is here in their things. Yeah. They even actually, I remember until now, I cannot look into my in-law's face, because he was told, you know what, you see, that person is queer. that person is queer, and then actually I remember I was also my in-laws are confronting me in a social place where I could, okay, are you queer? Why are you queer? A guy who looks great, who looks good, you went to school, what do you really want? Do you need money? Yeah, what do you really want? So a lot really went down, not until I decided to walk away from home, and then to start my journey. And remember that the U-turn, before starting my journey, I lost a brother towards HIV. But by the time I was at a tender age, so I didn't know what is really happening. So after coming out, and then my brothers passed on, so I decided to go and start actually looking forward. I'm stressed, I'm depressed, there's HIV, which I don't know about. So I went to Icebreakers Uganda. The challenge even started the more. By that time, actually, I didn't have clothes, I didn't have where to stay. So I didn't have any position at Icebreakers Uganda by the time. So I went there, the previous management gave me a shelter, and I started staying there. So staying there, I'm like, okay, what do I want as Brant? So challenges started. I all knew, because I had never even been in a close to a queer community for more than 5 people. So this one, I'm new in this community. I say a lot of new things, and I'm like, okay, how am I going to go about it? So that's when I started volunteering with Icebreakers Uganda, and then they started actually talking to me. They're like, okay, Brant, what challenge are you going through? I'm a person who takes long to come out. I need to talk about my challenges, and my challenges. So it takes to talk to actually to confide in someone. So I told them. So they started actually talking to me. They also gave me similar stories of coming out. They even asked me, "Why did you come out? Was this the right time to come out?" So I was really confused. Remember that we have a project that actually deals with people who are coming out. That is a community Sundays, whereby people come. It is an informal gathering. You come, you share the challenges you go through and all that. Guess what? Now, a loved one, my dad passes on. So I have to go to bury my dad. So when I went there, people started actually, yeah, Brant, we want to talk to you, and we want to talk to you. Brant, we don't talk to you. So you hear you're grieving your father, and then you see, I grew up in an extended family whereby my mom had kids, my father had kids. So a lot of actually children. So they started telling me, the first question, where do you work? So actually, the people even started actually being not actually in the burial, because the burial took like a week. Because my dad was an old person, and then actually an community leader in the village. So it took a week, and then with a lot of questions, a lot of discrimination. I remember even my sibling, my sisters and my brothers telling my siblings not to get closer to me because I will contaminate them with my queerness. So I went through a lot, and then yes, that is my coming out story. So I joined Icebreakers Uganda, started working, and then whenever I Google myself, I'm like, okay, wow, so because my work is out there on the internet, am I going to delete anything? Yes, I've blocked them, but what am I going to do? So I started camouflaging, posting about sex workers, posting about refugees, posting about, so that I can confuse them. But actually, people even have now. Guess what? They befriend my queer friends, so that they can get the right information regarding me. So when you befriend a queer person, we are like white people. We are honest. We tell you black is black and white is white. Yeah. So they started actually conversation. Every time I'm in a place, I receive a message from my family. Okay, yeah, now you're there. So it really, really, that is how my coming out was.
So it wasn't easy and it wasn't quick. And it sounds like you went from being very not visible as a queer person to being extremely visible as a queer person. That's a huge change. And I think when we think about coming out, we often think about things being a huge change, but you and I both know that you don't just come out once, right? Like it doesn't stop. with that one change. So how have you navigated coming out since then? Because that was the time that you know, disclosed to your family and became much more public as a queer figure. How do you navigate coming out moving forward? Because you travel a lot, like you go all over the world talking about your work. I'm sure that you travel within Uganda a lot to talk about your work. What is your personal approach to navigating the ongoing process of coming out as a leader within the community?
Okay. Coming out, as I told, it's not a one-off. Yeah, it is a process. And then by that time, maybe I was naive. Maybe it wasn't the right time for me to come out. Yeah, because it's a process. You cannot just wake up. And more so in our vicinity, in our setting as Uganda, because Uganda we value a lot. We value culture and religious too much. And for the definition of culture, you have to live up to standards. If you're grown up, as I say, I'm a Ugandan boy, you have to obey the systems. You have to be a churchgoer, which I am, because I am a believer. You have to, you have to marry. Yeah, in terms of marry, you have to marry. If you're a man, you expect to marry a woman. So coming out in our it's not really a bed of roses. A bed of roses. Yes, one, you might be serving someone behind in your community, but then what of you? It's not a one say whereby you will come out today or you come out tomorrow. It's a process. So that's when the question should be, how have I actually tried to navigate? So when all that things happened, so now my sister graduated from statistics. And then actually they told them apparently we have a lot of openings as queer people. So now she comes back, she's like, Brant, really, I'm pretending, I'm really sorry for what happened, but now I'm graduated, I don't have work to do. So I'm like, first of all, I don't have a firm that are looking for people to join work. And then that's when we started now having a conversation. So it's like, okay, Brant, why are you queer? I'm like, who were you sodomized? Were you molested when you're still young? When you grow, because we grow up with the house facilitators. So I'm like, no, I'm actually, yeah. So we started having that conversation, and then this is how I see her now coming back to me to learn more about why I'm queer. But remember, when you're coming out, that with that a story, now I learned that coming out is not just waking up. You need to first think through it. You need to first look at your loved ones, because people are hated, the stigma and discrimination. Because actually, I have a son who I love so much. So you think about all the situation. For example, if you're still going to school, yeah, I am person or being supported by family, you need to think twice without actually before coming out. Because coming out is actually, when I related to HIV, it's like actually coming to terms with your HIV status. Yeah, it's a process. Yeah, for you, if I get diagnosed that I'm HIV positive, it will take me process to come to terms with that status. You need to first actually look into your social, your political environment, your family. Yeah, okay, what will so that actually you really, when you're really coming out, you have a clear picture and you have a background. And also, remember by that time we didn't have mental health services at all. So remember now, actually, a young Brant, he doesn't know what to do, and now he's coming out with a lot of trauma. And actually, I most of the time, I amuse my friend. I'm like, you know what? For me, I'm a strong guy, because the things I've went through, and then I still smile, because you can never tell whether Brant is annoyed or what. I always wear my smile, whether in a good or bad time. So they're like, okay. I always tell them, no, I'm a stronger guy. But then I remember also sharing my story to Icebreakers Uganda family by that time, and then actually they told me, you know what, coming out is not a one-off. You need to, so it's like actually as I was saying to the family last side, it's like actually transitioning. Transitioning takes a lot of preparations, counseling for over 2 years, so that they prepare for what you're going through, the road you're taking through. But us, we didn't have those guide. When we're coming out, we didn't have those guidance. We're like, okay, I'm Brant, I know, so let me come out. And then you're like a soldier, which is not the case. Coming out it's a gradual process, and then that you have to ensure that actually it will not impact you like it did in my story.
Yeah. So what I understand from your story is that, you know, there was a lot that you gained from coming out. You certainly gained a lot of community around IBU. You became much closer to the queer folks in your network. But it's something that you're still dealing with your family, that it's still something that you actually have to maintain and then come out through, like you said, it's a process. So when young people or anybody asks you about disclosing, you know, their HIV status or, you know, their sexual orientation or their need for mental health services, there's stigma around all of those things. What do you tell them to think about before they make that decision?
I always have this conversation with them. One, I always tell them, you know what, one step at a time. And I always tell them, you know what, it's not coming out is not the end of everything. Yeah, even if you don't come out, it doesn't take away your sexuality. It doesn't take away your opportunities. Navigate through. For example, I gave you an example of you're still with family, they still pay for your school fees, you're still under their roof, you're still under their care. So navigate through the challenge, the things that are around you before you really come out. Because I don't want, I'll share an experience when we were still doing the youth dialogues for people living, young people living HIV. So the stories that actually the young people shared, they're like actually the stigma you face after disclosing to Colin that HIV positive. It starts with house. I read it to my brother, whereby my brother was actually diagnosed by HIV, and actually he was really in those bad stages. And then I saw a lot of discrimination, the cutlery, the Benson. They couldn't even allow us to go near him. Yeah. So that is relatively with come out. Yeah, I always tell people, you know what, don't rush while coming out. Seek the help you need. If you need to talk to ask people who have walked the journey, talk to us. We have now projects like, for example, I told you Community Sundays, whereby we share all these experiences. Yeah, actually, the experiences of coming out, they're almost related. So I tell you, you know what? Don't rush. First, wait, because in Uganda, the weapon we have, we use people to nearly accept us as actually being financially independent. When you're being financially independent, they will now try to cover up about your sexual orientation. I remember now when they're organizing a wedding, I'm the first one to be sent a message. You know what? Someone is getting married. So what I've used, or what are you really going to do? What I do, I send whatever I want, and then I don't attend the wedding. Because one, you might go to the wedding and you end up really, your mental health really end up being affected. So I always tell people, don't rush while coming out. First, navigate the issues around you, the many things around you, and make a decision. Coming out, I cannot force you to come out. However, there are situations that can force you to come out. Yeah, but then it's not it's not like going to a shop and then buy a donut. You need to first navigate what is around you, and then to analyze, do you have support system? Support system is really key in coming out. Do you have someone to talk to, or if something goes wrong, do you have someone to talk to? Yeah. Do you have actually maybe a therapist? Do you have friends that support you? Do you have you consulted people that actually really come out before making that decision?
So building a support system is something that you recommend people do before they even think about disclosing to anybody their orientation or their HIV status or their need for mental health support, which I know is something that throughout your career, you've been a champion of, that mental health is health. And that's something that's been central to the work that you've done at Icebreakers Uganda. Can you talk about you know, why that has played into your values so much. You mentioned not having access to mental health support when you were coming out. Why do you think that that has been such a commitment from you to make sure that other people don't experience that lack of support?
Now I'll talk with confidence, and now things have a bit changed. One, we have programs that can support people in different fields. One of them being coming out. One of the program is mental health program. I remember I'll give you a background of mental health. Before, like 2 or 3 years or 4 years back, we didn't know the definition of mental health. Not until the Stephen Lewis Foundation came up with a project named Active, to deal specifically with mental health. And then it came in a time whereby a lot were happening. We're having discriminatory laws, we're having these come out problems, we are having people being diagnosed with HIV. A lot was happening, and then we didn't know how to deal with it. And then I remember one of our workers who were going through mental health challenges, and we didn't know. Because I remember sharing that story about the person couldn't handle even a glass of water. The person couldn't sit on his own. The person couldn't even bath himself. But then actually we went to every medical expertise, and then they didn't find any disease. Not until we had to go to a mental clinical psychologist that defined that a disease that actually he was going through. So when I talk about mental system, now we know. And actually, I've heard about I've handled a case of coming out of recently, whereby the person like for me, I'm going to the social media or a family group and just write queer, and that is it. So I had to refer them to our clinical psychology or mental health department for them to get help or to get advice. And what I love about mental health is actually they advise you, but then the choice is upon you. So such projects, the one of a pillar of how do I say it? A pillar of support system. Yeah, you seek support. A lot is going on in Uganda. Today they are passing a law. The next time the person has come out to the family, and then the family, the father is in army, he pulls out a gun. So how do you navigate through that? So those are some of the projects that actually really with support from Stephen Lewis Foundation that has actually bridged the gap of what we did have. Because now people have help. They know they are where to go. If they need for example, I'll give an example of people living HIV. They have now support buddies. Whereby if you're going through any challenge, you have to really there's someone who is actually helping out. For example, if you're not if for example Icebreaker is not accredited to give out art, but if you walk into a mainstream to pick out your refill and you meet your auntie, and then you feel offended, what do you do? So it's about a support body that can go there, pick your medication on behalf of you. So some of the things we've put in place to help such people that are coming out, that are going through any challenges regarding their sexual orientation or gender identity, to enable them actually being firm, and then yes, start the journey. The journey is quite hard, but then if you need support, if you have the right support system without discrimination, affirming, welcoming, so it's kind of softens up.
Yeah. So that's so interesting. So even just a simple act of helping somebody relieve the stress of running into a family member while carrying their HIV medication, that's a part of the mental health programming that you folks offer at IBU, is just making sure that people have that support to do the regular everyday things that they need to do to stay healthy. And I'm really happy to hear you talk about the active funded project, the Right to Health and Healing, which you developed with colleagues from Uganda, but also Kenya. And I remember being at the AIDS conference in Munich in July, and you were giving a talk with, I think, Alan from SMUG and some other folks. And people started hearing in the global village that the talk was about mental health. And people just kept coming and getting interested, and then people started wanting to talk about their mental health journeys. So that's been quite, you talked about even just 2 years ago, like mental health not being really on the radar of a lot of people working in HIV services in Uganda, but now it's obviously something that people are talking a lot about. So that's really been a lot because of your advocacy, correct?
Sorry, I didn't
That's
get
been
that.
because of your a lot of your advocacy around mental health has really gotten a lot of attention for the topic in the area. And so when we think about looking forward, and we think about kind of next steps for mental health, next steps for inclusion for our communities, what is it? And I want to get a final message from you because we've got a couple questions coming in from our audience that I want to give to you. But what do you think, thinking about everything we talked about, coming out, stigma, the need for mental health services, what is the most crucial message that you'd like to leave with our audience today before we get to their specific questions?
The most crucial message I would actually leave with the audience before answering their questions, one is actually integration of, I would say, mental health in all programming. Because you see, if someone living with HIV, they need mental health services. If someone is going through coming out challenges, they need mental health services. If someone has lost a loved one, so mental health is like a sister to everyone. It's like water. You cannot do without actually drinking water. So what I need, what I want to echo is actually people support initiatives like mental health projects to queer communities, direct to queer communities, so that actually people we stop losing people. I remember when I was appointed as the clinic manager before becoming the executive director, we lost 5 people in 1 month over HIV related illness. Why? Because we didn't have mental health services. So what I want, support partners like Stephen Lewis Foundation to also to support communities that are being actually oppressed, the communities that have faced a lot of challenges while actually addressing some of the issues. And also solidarity, stand with solidarity. Yeah, solidarity is key, because maybe if I had a support system by the time, if I had people that were around me, that showed me love, that encouraged me, I wouldn't actually have went through what I went through. Thank you.
Yeah. Well, thanks for that, Brent. And actually, what you just said links into a question that we just got from the audience. Somebody is just acknowledging that in 2023, Uganda passed the anti-homosexuality bill into law. And that creates a very specific legal context for queer and trans people in Uganda. Within that context, how do you equip people to understand the legal risks associated with coming out within your jurisdiction?
So what we do at Icebreakers Uganda, one, we first, if the bill is being introduced, we first actually interpret the bill to the language that people know, and we summarize it. Because, for example, if you hear about, remember when people called me, you know what, Brant, when they passed the bill in Parliament, people thought that it was now a law. Yeah, you had actually, what we do, we always actually summarize it and then interpret it in the language they really do understand. So we always actually ensure with our partners, for example, SLF, to ensure that actually people know what is entitled into the bill and how is it, and how does it affect the LGBT community, so that they know if it's passed, if it's not passed, but then they know what's really what it really entailed. And the other thing is about I was we in Uganda we came up with CFE, that is convening for equality, that has actually a diverse body of queer. It's queer led to fight such laws or such policies. This convening for equality has lawyers, has actually clinics, LGBT-led clinics, has queer people inclusive, has doctors, has mental health champions, has, to ensure that actually we unwrap or we unwrap what is really what is it that the law, this body was created when the law has just actually passed by a parliament to ensure that no loose end is left. This body is specifically to fight for discriminatory laws and then policies. So these bodies are community led, whereby if you hear about because the question has always been, where's the evidence? So what we do, if it's about human rights violations, we have people that are dealing with human rights violations, and they have cases and reports regarding that. If about mental health, there's Icebreakers Uganda clinic in the convening for equality that actually presents data on how mental health cases are really going at a higher level. It's about the legal or the legal mind. We have lawyers that actually can define what a clause is like, and then actually then we say under this umbrella or organ, we always actually send out fact sheets. For example, what is the petition? What does a petition mean? Because I'm not a lawyer, I sometimes got confused when I heard about petition 14, 15, and 16. So we have lawyers that define this and give updates to our LGBT community. You know what? A petition A means ABCD. So now we are taking this. We are now going to Supreme Court, and then they also update our community member or LGBT people about the safety measures they take in this legal environment we're in, so that no one is less behind. And that's a part of IP, and also partnerships with mainstream. I remember when the bill was passed, Stephen Lewis Foundation used to reach out to us at least every week to ask. And then I'm not reaching out on email, but actually to reach a point of actually reaching now our WhatsApp messages. Like, okay, Brant, what can we do? What can we do? How can we be of help? How are you? And then we saw them actually adding an extra fund to the already existing fund to ensure that actually our clients are really safe. And also other measures that actually we did as Icebreakers Uganda to engage the local leaders. To safeguard our community members and staff members, whereby if the police is coming, the local leaders will tap us like, okay, Brant, the police will be passing by to check, so please either come or close the office, so that actually they don't come. And also I was part of the adaptation strategy, moving around the districts of Uganda to ensure there is continuity of service delivery between this legal environment, whereby we met with the city, the DHOs, RDCs, city leads, and to chairman, LC, the local leaders, to also inform them on what the importance of continuous of service delivery among the amidst the law. And actually the feedback I really get, it was really alarming, because we actually apparently some our RDC raising, one of the RDCs raising a hand. I'm like, yes, for us in our community, we cannot even deal with queer people. Yes, I want to thank the president of Uganda so without ignorance, people actually still love those feeling. Remember, we had a circular from government that says we shall continue giving services amidst the law without discrimination. Yet people are really doing right. So it was the good thing we are moving with Uganda's Commission, Ministry of Health, and then Global Fund. So that actually the continuity of service. But yes, it was effective, but however, it cannot, anyone cannot be without that. And then we've come up with projects like well-being, mental health and well-being, especially for staff members. Most of the time, we the frontliners we are not cared for. Yeah, remember you're in police, bailing out people. You're responding to policemen. You're there, and then actually you'll see your picture. Yeah, they're reading news, and then your picture appears. So having projects that are actually active to support specifically also people who are in service really actually helped us to see, okay, after these challenges, how do you revamp yourself? Yeah, we saw that actually ISLF and Active, they supported actually retreats for us to go out and rethink. Yeah, yes, this one, the law is here. Okay, how are we going to deal with our clients? How are we going to deal with our mental health? So those are some of the initiatives are there to ensure the continuity of service delivery in Uganda.
Yeah. So I'm hearing a couple of different layers of things that you are working on. So at the local level, you're making sure people understand how to interpret the law and they understand how it applies to them. But then also ensuring that the frontline workers who are serving those people have mental health services to make sure that they're able to sustain themselves through that work. But then you've also got the kind of farther reaching work of convening for equality, which is making sure that any kind of actions against the law or advocacy around it is being led by communities from within Uganda. So it's not being led by anybody outside of the country. And I know that Pride of Work Canada and SLF have signed on to a number of letters to the World Bank from Convening for Equality to make sure that we're not acting out of step with queer and trans people in Uganda, that it's being led by folks who are in the community. But then there's also relying on external partners, like you mentioned, SLF, the Global Fund, to make sure that there's still funding going to some of those programs that were required before the law and are going to be required after the law. So it sounds like you've got a very complicated landscape that you're dealing with. And I know we want to wrap up soon. And I don't want to leave on a note that's very complicated and very distressing, thinking about all the work you have to do. What are you excited about? Like, what's the thing coming out day? We kind of reflect on some of the difficulties that we've had, but ultimately, we do want people to feel hopeful. We want people to feel that they can be themselves within, whatever safety they've created for themselves. So to finish off, Brant, what is it that is keeping you hopeful, and what are you looking forward to?
I'm looking forward to a welcoming LGBT community. And I'm excited that actually I came out because I'm helping a lot of people to also come out. Because remember, once the thing is not said, it didn't exist. So if we're like 5 people, 5 brands that come out, people get to know that, what, that queer people do exist. Yeah, rather than actually keeping quiet. I'm not actually encouraging people to come out, but then sometimes we need to come out. For example, I'll share if people in power, one of the person that is queer, yeah, the people in power that might come out, maybe it can change the policies in Uganda that affect us, yeah. Because for example, I remember sharing when I attended Pride Toronto, I had met a lot of ministers, met the lawyers, met mayors, and I'm like, oh, which world am I staying in? Yeah, speaking about a politician, about your sexuality, what is happening there, they are inclusive in pride events. I'm like, okay, what if that happens in Uganda? Wouldn't Uganda be a safe place for us, or heaven for us? But then now even queer people that are in government are quiet. Why? Because of cultural, religious backgrounds, political positions they hold. So I mean, if we come out, for example, I will share an experience of people living HIV. When they started coming out, we saw that actually there's a retention onto care actually improved. We saw that actually people are now, it's U equals U. We mastered U equals because of their actually coming to pray with their HIV status. So as I conclude, I'm like, yes, when you're coming out, first actually look through in and outside, internal and external, without coming out. But then if you need to come out to save a life, please come out and save a life. Many people are dying in closet because they don't know what to do. If you know what to do and you have all the support system, please let us help our people so that actually we don't die in isolation. Thank you.
Well, thank you, Brant, because like you said, for people to come out and for people to thrive, they need safety. They need a community around them. They need support services. And that's exactly what you are providing at Icebreakers Uganda. So I think in closing, I'd just like to encourage our audience, get involved with our Partners in Pride program at the Stephen Lewis Foundation. It's a great way to show solidarity with Icebreakers Uganda and other similar organizations. You know, one of the things I love about volunteering with Stephen Lewis Foundation is one of our mantras, which is solidarity, not charity. All of our partners, you know, they get to direct where their money is spent because they know best how to confront these challenges. So thank you very much, Brant, for the sense of safety and well-being that you're cultivating for your community, for your leadership, and for joining us today after a long work day.
Yeah.
And for sharing all of your great advice and all of your experience. It's not easy to share some of the personal pieces with a group of relative strangers from halfway around the world, but we really do appreciate all that you've shared with us today. I do. I always learn something talking to you. So thank you so much. And after Brant, you have the last word. We'll turn it back over to Alan. So anything you'd like to say in closing, Brant?
I want to thank Stephen Lewis Foundation for always actually reaching out and working with queer communities. It's hard to find a foundation that works with diverse people, for example, grandmothers, and then actually work with closely with LGBT persons. So thank you so much, Stephen Lewis, for always actually walking this journey, not only with Icebreakers Uganda, but also other countries that face similar challenges. So please, people, support Stephen Lewis Foundation so that Stephen Lewis Foundation continuously support other communities that are discriminated like Uganda.
Thanks, Brant. Over to you, Alan.
Thank you so much, both Colin and Brant. This was a wonderful and very inspiring discussion. There's a lot to look forward to for LGBTIQ communities across the world, and thanks to leaders like you. I couldn't have asked for a better way to mark National Coming Out Day this year. We will continue our fight and will always champion health and human rights for all. To all of you who has joined us here, you can be a part of the Stephen Lewis Foundation's global movement to end AIDS. We would love for you to join us for our upcoming Give a Day campaign, taking place on World AIDS Day, marked annually around the world on December 1st. Our Give a Day campaign calls upon the individuals to mobilize their workplaces and organizations to give 1 day's pay on World AIDS Day to the Stephen Lewis Foundation to help our partners end AIDS. You could be the Give a Day champion at your workplace or amongst your family and friends. All you have to do is reach out to us via email, or you can scan the QR code and visit the link shown on the screen. When you sign up for a Give a Day campaign, you will receive a personal fundraising page to share with your family, friends, and colleagues. You will also receive powerful impact stories to share with your community and network. We will provide you with all the support and resources for you to be a champion for health and human rights. Thank you for joining us today, and we look forward to having you join us for Give a Day. Have a beautiful rest of the day.